As women, we navigate through a myriad of changes at various stages of our lives, from menstruation to pregnancy, postpartum, perimenopause, and menopause. And each phase brings its own set of doubts and questions, often leaving us seeking reliable answers amidst a sea of myths and misinformation. And it's crucial to turn to experts who can guide us with knowledge and empathy, ensuring that our health and well-being are never compromised. Today, we are privileged to have with us one such expert, Dr. Namratha S., a renowned laparoscopic surgeon and a gynecologist, a beacon of trust in the field of women's health. Dr. Namratha is here to shed a light on some of the most common concerns women face during periods and menstruation, debunk myths, and provide expert advice that empowers us to make informed decisions about our bodies. Welcome, Dr. Namratha, to Beyond Her Story. It's so good to have you here.
Thank you so much, Sneha. I'm glad to be here.
Yeah, I think, women go through a lot of phases in their life, from menstruation to pregnancy to menopause. So I think maybe we'll cover the periods and, myths and things around it and see if we can figure out something.
Sure.
Okay, I think we'll start with the most basic question, which is about pain management. So what are some of the things that women can do for pain management, and are there any natural remedies for these?
Yes, surely. This is one of the most opted questions by any patient or girls who are suffering from period pain. So period pain is one of the most common things we see at a younger age, college-going teens who have been having their menstruation for the first few years, and it makes them so incapable that they cannot do their daily activities as well. So what we recommend is, first of all, the main thing is lifestyle modification. So there's so much of competition, so much of stress from family, from friends, everybody. So we would, advise them to go for basic lifestyle changes like yoga, getting yoga into their daily activities. We have specific yoga poses, we have yoga asanas which help decrease the period pain. One of them is Surya Namaskara, which is a very good kind of intervention they can do. Then eating healthy as such, having good hydration round the clock helps them to come over this period pain. And there are a few natural remedies which has been told by our grandfathers, grandmothers. So some of them just don't agree with it, but still people follow and they get pain relief. They have this hot water bags, they can use it. They have jeera water, fennel water they can have. And as such, normal hydration is also very good during the periods. Coming to the painkillers, yeah, definitely painkillers are very safe, and there are different painkillers, different doses. So it's better always, to go to a gynac if you are feeling that there is continuous necessity to have a painkiller every period you are having. Get yourself screened so that you don't miss out anything, because nowadays there are many other things which something called as endometriosis, which cannot be cured just like with natural remedies or painkillers. So if you are feeling every cycle it's coming the way of your activity, definitely go and consult your gynac. Your painkillers are quite safe, and whatever painkillers as gynacs we advise it just at the start of the menstruation. Usually the first 2 days are the heavy cycles. So that day particularly we ask them to take it even before the pain starts, so their effect is more and the much needed dose is very less.
Okay. So let us go to the next common questions that people ask. Does PMS really exist?
Yes, PMS really exists. It's one of the most difficult situations for a girl or a woman to handle, because many people rub it off around them, telling, what are you doing? Why are you so irritable? But definitely yes. And the most important thing for a lady, who can bear it is giving a mental and physical support from their family members.
Yeah.
You want to ask something?
No, I mean, PMS is premenstrual symptoms, or?
It's syndrome.
Syndrome.
Premenstrual syndrome. So as you know, there are a lot of hormonal fluctuations occurring over the cycle. Usually our period is for 28-day cycle, 30-day cycle. So the first 15 days, the second 15 days, it changes. So just before menstruation, there are certain hormones which kind of make you more irritable, more anxious, having this short-temperedness, and there's so much of breast heaviness, body heaviness, bloating sensation. So all this definitely occurs just before you get your period day.
Okay.
And for this, it's again the lifestyle which we tell, which is very important. Kind of have a regular exercise, regular schedule in your lifestyle, so that you can handle your PMS without any other interventions.
Okay. I think, like you rightly said, a lot of people take it lightly.
Yes.
Yeah, I think so. That has to change. That people have to be aware. I think awareness is the first step towards both PMS and the menstruation cramps that women and girls go through during their periods.
Exactly. And PMS is not like it is limited to girls or it's limited to reproductive age. Even perimenopausal, before the menopausal symptoms start, they still might undergo a lot of PMS issues. And so many patients come over to us, they kind of are not able to handle it themselves. They take medical help from us.
Yeah.
So definitely that is also advised.
So, in addition to pains and in addition to PMS, there are a lot of women who also go through irregular periods. So, what constitutes this irregular periods, and when should women actually go and seek a doctor's advice?
That's a very good question, because irregular periods is one of the most common problems, which ranges from the age of say 15 to 45 till you get your menopause. It's not just the youngsters or the reproductive age common. So there are a lot of causes for irregular periods, but usually now that as you know how the lifestyle is changing, most of the girls are started menstruating by the age of 11.
Yeah.
So they're hardly like in 5th, 6th, which is a drastic difference, where we would see girls having their menstruation at around 8th standard, 9th standard. That's much more
14,
later.
15.
Yeah. So now, as such, the puberty is very early. So usually the entire puberty cycle, what we tell, usually takes at least 4-5 years to set in.
Okay.
So previously you used to give that 18 years as the landmark, 17 to 18 years, not to have much interventions to girls. We used to give the time period. Now, as such, the menstruation, the puberty changes occur even very early. So maybe at around 16, we can give time till 16. So many kids, many girls have their cycles once a year, just twice a year. That's still okay. You just need to counsel them. Again, I would stress, have these, because they eat a lot of junk. They eat a lot of maida products or bakery products, whatever. The sugar factory should be, kind of told to them what is healthy, what is not healthy, because most of them go to college, go to schools, they jump with friends and they like it.
Yeah.
So see, they're all girls growing up, we can understand, but still, there should be a limit to whatever they eat. So I think that is the main crunch we have to stress upon at 11 to 16 years. Once they're 16, just observe the cycles, observe their weight, how they're putting on and all that. Once, if everything is going right, still if they're not getting a monthly cycle, then definitely they need some help there.
Yeah.
And there are many causes now, and one of the main reasons I would tell is something called as PCOD, that is polycystic ovarian syndrome. Yeah. So many of them would have Googled before they come to me. They tell me, is it PCOS or PCOD? So I tell both are the same, dear. You have to just figure it out what kind of problem you have.
Yeah.
So it's all individualized again, because some of them are, not even overweight, but still they're having irregular cycles. Some of them are overweight or obese category. So accordingly, we will guide them. Again, there are issues when they want to get married, or they get married and have kids. So when they plan a family, again the irregular cycles is one big issue.
Yeah.
It causes infertility again, it leads to infertility. So again, there are overweight issues, diabetics. There's so many diabetics who, get screened very early. Now we are picking up as early as 30, 35, when they are falling in borderline diabetes, because again this PCOD, what I was telling, is associated with a lot of altered glucose metabolism in our body, and that indirectly falls into pre-diabetic states. And again, because we are becoming more westernized, modernized, so the diabetes is taking upper hand in our lifestyle. So again, those things need to be screened. And one more very important thing is thyroid. Thyroids have to be checked regularly. So many people come and tell me, I don't have family history, I'm so healthy, no doctor, I don't have thyroid at all. No, there's something called a subclinical thyroid hyperthyroidism, wherein it just shows in your blood test. So that might be leading to her irregular periods. So it's always good to screen yourself for thyroid diseases.
Okay. So there are multiple causes which can lead to irregular periods. And like, when should they go and show it to a doctor? Like you said, for the young girls, maybe until 16, they turn 16, they should go. What about the other people who are actually having regular cycles and then suddenly go into these kinds of...
all fingers are not the same. So, same way, all cycles won't be the same. So, there might be some stress factor, or people might have taken preponement or postponement tablets for their own personal issues. So, one odd cycle is still manageable. If it goes more than 2 cycles, the person is gaining weight and having other symptoms, or even if it is more than 3-4 cycles, not getting proper periods, I think definitely that's the time you have to show up.
So nowadays we see a lot of people talking and using menstrual cups, right? So what are some of the things that women need to know about their hygiene and safety? And is it safe to use menstrual cups?
Yes, definitely. Menstrual cups are a boon to girls as far as I personally feel it. So most of them are so much career oriented, so much they're achievers. So they need to be free of their mind also during menstrual cycle. And you should use menstrual cup. It's very, very safe, very easy to handle, and its longevity. Basically, it's very sustainable. It comes for over 6 to 7 years if handled really well. And it's very easy to handle as well. So main fear the women have is how to insert it and how to remove it. So they feel like once it is inserted, it won't come out. So definitely again there are few techniques, tips and tricks how to do it. Maybe first 2 cycles might be a little tricky handling it, but definitely after that, it's any new thing, any new job or any new thing, you just need some time, right? So give some time for yourself and don't be in a hurry, and always inform your gynac or take advice. Nowadays again there's so many cups available online, so I would particularly tell women not to go with cups which have stem. So the stemless ones are very easy to handle, because when you pull it out with suction, they usually use the stem, which might be harmful. So go for a stemless cup, and according to your size, you need to decide your cups.
And what about the hygiene part?
Hygiene part, it's menstrual blood is not at all infective. So we are advising ladies to change it every 6 hours. So the cup size, it can hold around 20 ml of menstrual blood. So even during the heavy periods, it might require 4 hours to change your cup, which is okay. And when you are actually on your 3rd day or 4th day, you can as well change it at 8 hours as well. So, and because there is something called as vacuum introduced, the menstrual cup, the menstrual blood just stays there. It doesn't flow anywhere else. So when the cup starts leaking or something, then it seems that the cup is full. So the entire menstrual period, a lady loses around 80 ml. So it's most commonly on the 2nd or the 3rd day you have the maximum bleeding. So say you lose around 25 to 30 ml, that should be those days you change it more frequently. And so it's very hygienic, and it's made silicone based, and it is medical graded. So again there's allergies or infections are very less unless and until you're not kind of managing it well. So just you need to put it in hot water or boiling water and use it.
So what are the other menstrual products that are available, and why did this cups come into the picture?
So as we were all using sanitary pads, they have a lot of chemicals in it. So ammonia content is very high, which is again the main cause for rashes, unhygienity. So we as such found this cup to be very, very actually it doesn't have any chemical, as I told you, it's just silicone based, and it's very easy to use, and definitely the chemicals which we are exposed to is avoided. There are many other products, like we have menstrual cloth, menstrual tampon. These are also, tampon is again, previously it was used more than cups. So now because cups have come, it's easier to handle and dispose. So it's taken over tampons. Cloths again are their reusable cloths. So in the market you get many kind of brands, or you can tell, and they're all can be washed in hand and just dried in sunlight. Again, easy to maintain. The heavy days, again, go for a cup, I would advise, because cloth again, kind of requires you, if you're working, you're elsewhere, it kind of, you'll have to change it. So go for cups, and the 3rd day or 4th day, you can manage with cloths very, very comfortably. So these are the.
So out of everything, I think pads are the one which are a bit like you said, it has chemicals and all that, right?
And it actually amounts to a huge amount of waste.
Waste, yeah, that is for sure. Yeah.
So and it is something again which is coming in the green revolution.
Yeah.
So we avoid so much of waste. There are statistics which have proven, there are studies which have proven that it takes the lead in the medical waste management, which is again chemical based. So you can reduce it, and nowadays even in airports or you go into transit points, you have certain machines which actually degrades this sanitary napkins. These sanitary napkins again, there are napkins which are chemical less, which are ammonia free again. So these
and also, degradable,
yes,
probably.
Degradable, sustainable. So again, you properly dispose it. Again, you will contribute a lot to this world.
Yeah. So Dr. Namratha, there are a lot of myths and there are a lot of things which are actually true, surrounding periods and menstruation. So let me ask you a few questions, and if you can tell us whether it's actually a myth or truth, then it will really be good.
Okay.
So let's start with exercise. So they say that you should not exercise during periods and it will lead to heavy blood flow.
So yeah, exercise actually relieves period pain.
Okay.
So I would tell people not to overstrain themselves. There is basic kind of I was telling you about yogasanas. So they are all very gentle exercises. Normal walk definitely can be done. Period exercises actually relieve period pain and they feel much better. It's a myth that you should not exercise, but definitely don't overdo it.
Okay. What about swimming? Can swimming be done during periods? Is it a myth or a truth?
See, as far as you use your menstrual cup and you're all good with it, you don't, kind of contaminate things.
Yeah.
It's definitely doable.
Okay.
People go for treks, people go for swim, so it's all doable with these fantastic revolutions.
The next question is about the food that we eat. Like there are a lot of people who think that certain kinds of food should not be had during the periods, like pickles, tamarind. So is it a myth or truth?
No, it's again a myth. So there is nothing like if you eat pickle, you will have a heavy menstrual flow. Nothing like that. So the body doesn't know whether you are eating sweet or, the uterus doesn't know whether you are eating sweets or tamarind. So definitely nothing like that. Only the hydration has to be maintained. It is nothing that this has to be avoided or that has to be avoided.
Okay, good to know. Then there's also another thing that goes like, if you have normal menstrual flow, you can become anemic. So is that a myth or a truth?
See, as we were discussing, the normal menstrual flow, we lose around 80 ml of blood deficit. So anything above that will come in as a form of clots. So whenever a lady or a girl is having clots in her blood flow, or she feels the period flow is more than her regular periods, or she's using more than 4 or 5 pads a day, or the cycle lasts for more than 8 days, then only it will lead to anemia. Otherwise, the normal period flow doesn't take away your blood.
Good to know again. So there are some people who also feel that you shouldn't have bath during menstrual cycle. So is that a myth or a truth?
No, you need to have bath, keep yourself clean, and that makes yourself fresh, and as such you are having a period pain. Even the hot bath, as I told you, even a hot pack will help. The same thing applies. So you should
have bath during menstrual cycle. Okay.
Yeah,
I think Dr. Namratha, this has been a wonderful conversation. I mean, though we've all gone through all these different phases in life, still there are certain unknowns and there are certain new revolutions, like you call it, that keeps coming, and there's a lot to learn when these things happen. So it's been a wonderful conversation, and I'm sure, after watching this episode, there'll be a lot of questions surrounding other phases of life as well. So I think, thank you for sharing all the tips, tricks, the myths, the truths, and the things that, we need to go through our regular life.
That's so wonderful. I just hope we reach many people, many girls or ladies see it and follow what we have told, or reach out to us so we can conduct more sessions on this.
Yeah. So what we can do is in the description we'll leave out certain links and certain email IDs or handles or something.
Yes.
So people can get in touch with us, and then we can see how we can help them.
Sure.
Thank you.
Thank you, Sneha.